Living with diabetes means paying close attention to various aspects of your health, including the medications you take. Some medications can significantly affect blood sugar levels, potentially complicating the management of diabetes. In this video, we'll explore some medications you should avoid if you have diabetes, backed by scientific studies and expert opinions. But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin. One category of medications that can have a profound impact on blood sugar levels is corticosteroids. These drugs are often prescribed for their anti-inflammatory properties, and they're used to treat conditions like asthma, arthritis, and allergies. Studies have shown that corticosteroids can raise blood sugar levels by increasing insulin resistance. This effect can be particularly problematic for individuals with diabetes, making it harder to keep blood sugar levels within a safe range. For example, a study published in the journal Diabetes Care found that patients receiving high doses of corticosteroids had significantly higher blood glucose levels compared to those not on these medications. Another group of medications to watch out for is certain types of diuretics, commonly known as water pills. Diuretics are often used to treat high blood pressure and heart failure by helping the body eliminate excess fluid. However, some diuretics, particularly thiazide diuretics, can lead to increased blood sugar levels. Research published in the American Journal of Hypertension has highlighted that thiazide diuretics can cause a significant rise in blood sugar, which may necessitate adjustments in diabetes medication dosages. Beta blockers, a class of drugs typically prescribed for high blood pressure, heart disease, and anxiety, can also pose challenges for people with diabetes. These medications work by blocking the effects of adrenaline, which can blunt the symptoms of low blood sugar, making it harder to recognize hypoglycemia. Additionally, some beta blockers can interfere with insulin secretion, leading to higher blood sugar levels. A study in the journal Diabetes Technology and Therapeutics found that patients taking non-selective beta blockers had more difficulty managing their blood sugar levels compared to those on selective beta blockers. Antipsychotic medications are another group that requires careful consideration. These drugs are essential for managing conditions like schizophrenia and bipolar disorder, but they can also affect glucose metabolism. Studies have shown that both typical and atypical antipsychotics can lead to weight gain and insulin resistance, increasing the risk of developing diabetes or exacerbating existing diabetes. Research published in the Journal of Clinical Psychiatry indicated that patients on antipsychotic medications had a higher incidence of new-onset diabetes and worsening glycemic control. Certain antidepressants, particularly tricyclic antidepressants and selective serotonin reuptake inhibitors, or SSRIs, have also been linked to changes in blood sugar levels. While managing mental health is crucial, it's essential to be aware of these potential side effects. A study published in Diabetes Care reported that some patients taking SSRIs experienced improvements in insulin sensitivity, while others saw no change or an increase in blood sugar levels, highlighting the need for personalized medical advice. Statins, widely prescribed to lower cholesterol levels and reduce the risk of cardiovascular events, have been found to have a dual effect on diabetes. While they are crucial for heart health, several studies have indicated that statins can increase the risk of developing diabetes. The Journal of the American College of Cardiology published findings that suggest a link between statin use and an increased risk of new-onset diabetes, particularly with higher doses. It's important to balance the benefits of statins in preventing heart disease against the potential risk of affecting blood sugar control. Oral contraceptives are another type of medication that can impact blood sugar levels. Some birth control pills, particularly those containing high doses of estrogen, can lead to insulin resistance. This effect can be more pronounced in women with a predisposition to diabetes. Research in the journal Diabetes Metabolism Research and Reviews has shown that women using certain oral contraceptives had higher fasting glucose and insulin levels, emphasizing the need for careful selection of birth control methods in women with diabetes. Thyroid medications, specifically those used to treat hypothyroidism, can also influence blood sugar management. While treating thyroid dysfunction is essential, over-replacement with thyroid hormones can lead to symptoms of hyperthyroidism, which can raise blood sugar levels. A study in the Journal of Clinical Endocrinology and Metabolism found that patients with over-treated hypothyroidism had higher blood glucose levels and increased insulin resistance. For those managing gastrointestinal issues, some medications like proton pump inhibitors, or PPIs, and H2 receptor antagonists, commonly used to treat acid reflux and ulcers, can have unexpected effects on blood sugar control. Research has indicated that long-term use of these medications may be associated with an increased risk of developing diabetes. A study in the journal Gut reported that prolonged use of PPIs was linked to a higher incidence of type 2 diabetes, underscoring the need for monitoring and potentially exploring alternative treatments. Finally, let's discuss over-the-counter medications and supplements. Many people may not realize that some common over-the-counter drugs, such as decongestants containing pseudoephedrine, can raise blood sugar levels. Additionally, certain dietary supplements marketed for weight loss or energy enhancement, like those containing caffeine or ephedra, can also impact blood sugar control. A study in the journal Diabetes Spectrum highlighted that patients using these over-the-counter products experienced significant fluctuations in blood glucose levels, which could complicate diabetes management. Now, saving the best for last, let's talk about the importance of being proactive and informed. Managing diabetes effectively involves a collaborative approach with your healthcare team. If you are prescribed any new medication, it's crucial to discuss with your doctor or pharmacist how it might affect your blood sugar levels. Monitoring your blood glucose more frequently when starting a new medication can help you and your healthcare provider make any necessary adjustments. Additionally, keeping an open line of communication about any side effects or changes in your condition can ensure that your treatment plan remains safe and effective. Regularly reviewing your medication regimen with your healthcare provider is essential in managing diabetes effectively. It's important to provide your doctor with a complete list of all the medications you're taking, including over-the-counter drugs and supplements. This can help identify any potential interactions that might affect your blood sugar levels. Additionally, using a medication management app or keeping a written log can assist in tracking how your blood sugar responds to different medications. Educating yourself about each medication's side effects and maintaining open communication with your healthcare team can significantly contribute to better diabetes management and overall health. Being aware of these potential medication interactions can empower you to take charge of your health and make informed decisions. It's always a good idea to review your current medications with your healthcare provider regularly, especially if you have diabetes. By staying informed and vigilant, you can help prevent complications and maintain better control over your blood sugar levels, leading to a healthier and more manageable life with diabetes.